over the past 6 months, we've used a lot of the ClearView 3 lens and a lot of the Odyssey lens for our patients. And I want to share our patients' experience after having implanted about 200 of these and 200 Odyssey lenses. And I've determined which lens works the best overall and has the highest satisfaction rate. Let me just give you the bottom line. It's this lens, the Odyssey. First, let's talk about the ClearView 3 lens. It's a segmented bifocal design where one portion of the lens is designed to deliver sharp, faraway vision, and another portion of the lens is designed to give great reading vision. And it really does work well, and it's insensitive to where the lens is rotated as long as we line up the distance segment with the patient's visual axis. And we started using this lens in April of 2024. The hope was we could now have a lens that could deliver far, mid, and near vision without glasses and without a nighttime halo effect that we were seeing with the lens that we were using most commonly at that time, which was the PanOptix lens. Now, the PanOptix lens is designed with rings in the lens, and these rings give the PanOptix the ability for patients to see near, mid, and far without their glasses. And the PanOptix worked well for the vast majority of patients, but we found some patients didn't like the quality of their vision with the PanOptix, and some patients felt like the halo effect with the design of the PanOptix prevented them from feeling comfortable when driving at nighttime. So we used this ClearView 3 lens, and in about the first 100 patients, I felt really good about it. Our patients were seeing well, they seemed to be very happy, but as time went by, and over the second 100 ClearView 3 lens patients that we treated, we found that about 5% of them did not feel comfortable with their reading vision. They felt like their reading vision was shadowed, blurry, just not sharp. And so the whole reason that a person would choose to have a premium multifocal lens is they want to be able to see near, mid, and far without glasses. And if these patients with the ClearView 3 lens couldn't read, then they were very unhappy. And so what did we do with this 5% group of ClearView 3 patients that were unsatisfied? Well, we performed a procedure called intraocular lens exchange, where we would remove the ClearView 3 and we would replace it with another lens. The lens that we chose to replace the ClearView 3 with was this lens, the Odyssey. And out of all patients that we removed the ClearView 3 because they did not like their quality of vision and they couldn't read, was this lens able to deliver the result that those patients wanted? Yes. So we were able to take the unhappy ClearView 3 patients, give them an Odyssey lens, and they became satisfied. So that was remarkable. So then we started using more and more Odyssey lenses and found that overall, the patients really consistently saw well with the Odyssey lens. They could see far, mid, and near. Their quality of vision was great. We were a little bit concerned with the design of this lens. It's a ringed lens, and we would inform all these patients before they receive the Odyssey lens that you're going to see a nighttime halo. But how often would we have to remove the Odyssey lens because of patients not liking their quality of vision day or night? How often would we find a patient out of the first 200 recipients of this lens that felt that they could not drive safely at night? So far, it's 0. Now, I'm sure we're going to find patients who are dissatisfied with their quality of vision or their vision in some way, shape, or form with this lens. There's no perfect lens implant. But so far, the Odyssey seems to be performing very well. So how does this Odyssey lens compare with the PanOptix, which was our go-to lens from 2019 until essentially May of 2024? we were finding that about 2% of patients with the PanOptix did not like their quality of vision. So we would have to remove those lenses. If I can find a lens that delivers consistently great results and patients are consistently happy, that's the lens I want to use. Because my goal, if you have surgery with me, is that you receive a lens implant, you like your vision, you're happy. Maybe it's not perfect. Maybe you don't see like you're 25 years old, but I want you to be very satisfied with the way you see. If you have to wear reading glasses sparingly, that's totally okay. And I've created some videos over the past 6 months sharing my experience with the ClearView 3 and the Odyssey lens. And as of October 16th, 2024, the date of filming this video, this is my go-to premium multifocal lens. Now, I've had several patients travel to come see me because they want to have full range of focus and the hope that they can see well day and night without glasses and see virtually no halo is very appealing to them. And I'll place the ClearView 3 lens still. However, knowing what I know now, I'll advise patients who want the ClearView 3, you have a 95% chance that you're going to see great. No issues whatsoever. However, there's a 5% chance that if you receive the ClearView 3 lens, you will not like your quality of vision. Mainly, your reading vision will not be satisfactory. And if you are dissatisfied with your reading vision and you want to have that corrected, then you will have to come back and see us and undergo a procedure called intraocular lens exchange. We will remove the ClearView 3 lens and we will replace the ClearView 3 with the Odyssey lens. Let me share with you this chart that shows my experience with these 3 premium multifocal lenses. Overall, all 3 are excellent. However, the bottom row to me is most important because in my opinion, the goal is that patients just see well and we don't have to do repeat surgery on them to address visual side effects. And the ClearView 3 has a 5% dissatisfaction rate. The PanOptix, in my experience, has a 2% dissatisfaction rate. And I'm sure we're going to find Odyssey patients as we continue to use it and gain more experience that will be dissatisfied with the Odyssey. But thus far, the dissatisfaction rate in my first 200 Odyssey lenses is less than 1%. Let me address nighttime halos. With these 2 lenses, because they're similar in design, they both have rings in their lens design. And so you would think that these rings are going to create a halo effect, and they do. But what I'm finding and what our patients are expressing is when we ask them, hey, how bothered are you with your night vision? Most of the patients with the Odyssey will say, the halo effect doesn't bother me at all. The patients, on the other hand, with the PanOptix lens, they will notice the halo, and most are not bothered. But there is a distinct, noticeable 2% group, maybe even a little greater than 2%, that say these halos at night with the PanOptix are very bothersome. And thus far, that percentage of patients that are really bothered with their nighttime vision with the Odyssey, it's been less than 1%. Now, some patients will say, I want the ClearView 3 lens because I don't want to see nighttime halos. And yes, you'll see very little halo with the design of the ClearView 3 lens. But some patients with the ClearView will see a nighttime artifact because the segment in the middle between the long distance and the near section of the ClearView 3 lens will create a little nighttime artifact that patients notice sometimes is like angel wings or flares or a streak of line or a bar of light that is slightly distracting. The patients with the Odyssey lens will see rings around lights. We tell them that beforehand, before they even decide to have this lens implant. But thus far, patients with the Odyssey lens, their nighttime vision has not been unsatisfactory. They have all stated that, yes, they see a halo, but they then followed up with, it's not that bothersome, which is very refreshing to hear. So if you travel from far away and you're coming to see me to have premium lens replacement or cataract surgery, and you want a lens that's going to give you the ability to read your phone, your computer, see to drive, essentially be as minimally reliant on glasses as possible, my recommendation, my first choice lens, is going to be the Odyssey lens as of October 16th, 2024. Another chart that I'm going to share with you is also on our website, and it just shows the various lens implants that we use and that we offer to our patients. Of the premium lenses listed in blue, my preferred lens is definitely the Odyssey. We do use the other lenses listed on this chart, and their relative strengths and weaknesses and costs are listed as well. So feel free to review those, or feel free to go to our website, austineye.com, and review them. So please stay tuned for more updates. I'll continue to share my experience on this channel as we gain more experience and as new generation premium lens implants emerge and become commercially available. I hope this video was helpful. Thank you very much. Have a wonderful day. Bye-bye.